Are you the approximately 1 in 3 Americans in the United States living with metabolic syndrome? Hello, everyone. I'm Dr. Katrina Mattingly, Chief Medical Officer here at Options Medical Weight Loss. Now, there are several criteria that are used to diagnose metabolic syndrome. Waist circumference greater than 35 inches in females and 40 in males. A systolic blood pressure greater than 130/85. Now, the systolic is the top number. Fasting blood glucose greater than 100, that's our blood sugar. Triglycerides greater than 150, or HDL, that's the good cholesterol, less than 50 in females and less than 40 in males. And remember, you need 3 of these criteria met to be diagnosed with the metabolic syndrome. Now, how did I get metabolic syndrome, and now what? So we don't have an exact cause for metabolic syndrome, but we do know that environmental factors, genetics, insulin resistance, physical inactivity, and poor dietary habits can definitely lead us to some of the criteria for metabolic syndrome. And when we get metabolic syndrome, our risk factor goes up for all the chronic diseases, the heart disease, osteoarthritis, diabetes, cancer, infertility. Those are just a few. So I have metabolic syndrome, doc. I met 3 of those criteria. So what can I do about it at this point? Well, the main thing you need to do is decrease your inflammation in the body. One of the main ways you can do that, we talk about that a lot here at Options Medical Weight Loss, is to lose some weight. If you lose some weight, you lose a lot of that sick fat that leads to some of that hormonal imbalance and inflammation in the body that tends to make us gain weight. So if you lose some of that sick fat, you're going to definitely decrease a lot of that inflammation. Restore your gut microbiome. Eat whole foods and less processed foods. Take an oral probiotic supplement if that helps, and make sure that you stay hydrated with lots of water. Find stress relief. When you decrease the stress hormone in your body, which is cortisol, you will decrease levels of inflammation throughout the body. And decreasing your stress is not sometimes as intense as having to go run around the block or slug it out at the gym. It could be as simple as raising the shade so you get fresh sunlight coming in through your window so that your vitamin D levels go up. I know a lot of times in the winter, when we have long, dark days and not a lot of sunlight, some people get a side lamp, which provides them with mimicking sunlight throughout the day that will help them to elevate their mood and lift those endorphins. You could also crack the window and just get a little bit of fresh air. You can move around the home. You can eat some foods that make you feel good and make you feel good inside and not sluggish and feeling awful after you eat them. Go to your doctor regularly. That's another one. Annually. It's so much easier to take control of a medical problem in its infancy when you first notice it than to wait 5 years or to wait a decade to go to the doctor. And the problem is well beyond your control, and you need aggressive medical intervention or a lot of medications to control it. Get on meds if you need to. That's a lot of times what happens if we wait a little bit too long to go to the doctor. And develop a meal plan that you actually enjoy and you will actually stick to. If your neighbor's on one thing and you're like, that's just not for me, I don't know how she can do it, then find something that does work for you, that helps to restore that gut microbiome again and make you feel good on the inside. So at Options, we are used to having patients coming in all the time who are telling us, I know I have chronic levels of inflammation in my body. I know I'm gaining weight. Maybe there are all these meds and they've been diagnosed with metabolic syndrome. We are in the business of helping you to lose weight and helping you to feel better and helping you to get your mind right so that you can decrease your risk factors for metabolic syndrome. Remember, losing weight will definitely help, along with smoking and getting up and moving as well. Weight loss is not the end. It's only the beginning. Please click the link below if you'd like a free consultation or need our help. Because at Options, we have options for everybody. Did you like this video? Like, subscribe, and ring that notification bell so you can stay up to date on our latest videos. You can also visit our website using the link below to schedule a free consultation with us. We have options for everybody.